are considering a career in the healthcare industry, congratulations. You have a wide array of choices before you. The healthcare industry has many different avenues to choose from. If you prefer to work in the front lines, helping people and interacting with people, there are so many areas to choose from. Or maybe you prefer to be behind the scenes, helping people with little to no interaction. There's also a wide area of career paths to choose from in this area as well. The challenge is not finding a career path, but rather narrowing down the career path in this exciting industry that is just full of opportunities. Healthcare careers cover every occupation from athletic trainers to surgical technologists and everything in between. Therapists, assistants, and even personal care aides make the Bureau of Labor Statistics healthcare jobs. Depending on where your interests lie, you may opt for careers in healthcare in the chiropractic, dental, or even pharmacy fields. And don't forget about the nursing-related types of healthcare jobs or specialized jobs such as phlebotomist or surgical technologist. The good news is that the education required for careers in healthcare range from high school diplomas for personal care aides to associate degrees for radiation therapists and radiologic technologists to bachelor degrees for some therapist jobs to master's and doctoral degrees for nurses, doctors, and many therapists. You can land a job in a few types of healthcare careers without a degree, but you'll need a certification or a non-degree award for jobs such as dental assistants or surgical techs. The job market looks good for all healthcare careers currently and over the next 10 years. The baby boom generation is aging and an increase is expected to accommodate their care. Increased access to health insurance due to recent changes in health insurance legislation is also a factor in the projected growth in healthcare related jobs. For example, nursing jobs are projected to increase 31% by 2022, and pharmacy jobs are up 14% over the next 10 years. And physician and surgeon jobs are expected to grow by 18%, all above the 11% average increase of all occupations combined. There are also many non-clinical healthcare careers, jobs such as medical assistant, medical transcriptionist, and medical secretary. It will come as no surprise that the healthcare careers requiring advanced education and degrees earn the highest salaries. Doctors, for example, average more than $187,000 annually. Physician assistants don't do too poorly, though, with a median salary of around $90,000. Physical therapists and occupational therapists earn in the mid-70s. EMTs and paramedics gross around $31,000, and LPNs bring around $41,000 before taxes. Home health and personal care aides are at the bottom of the list, though, with a median wage right around the $20,000 annually. The Association of Schools of Allied Health Professions defines all allied health as a segment of the healthcare field that delivers service involving the identification, evaluation, and prevention of diseases and disorders, dietary and nutrition services, and rehab and health systems management. There are 5 million allied healthcare providers in the United States who work in more than 80 different professions and represent approximately 60% of all healthcare providers. The number of allied healthcare providers is likely to grow as jobs in the healthcare industry will grow from 15.6 million to 19.8 million between 2010 and 2020. An increasing number of those jobs will require people with bachelor's and graduate degrees. Some allied healthcare providers work collaboratively with other providers, including physicians, nurses, dentists, and pharmacists. They may play roles in evaluating and assessing a patient's needs, keeping the physician and others informed of the patient's progress, and caring for the patient. Others work independently as specialists in exercise, nutrition, health education, and speech and daily function. The allied health professions fall into two broad categories: technicians or assistants, and therapists or technologists. Technicians are trained to perform procedures, and their education lasts less than 2 years. They are required to work under the supervision of a technologist or therapist. This part of the allied health field includes physical therapist assistants, medical lab techs, radiological technicians, occupational therapy assistants, recreation therapy assistants, and respiratory therapy technicians. The educational process for therapists or technologists is more intensive and includes acquiring procedural skills. In addition, students learn to evaluate patients, diagnose conditions, develop treatment plans, and understand the rationale behind various treatments in order to judge their appropriateness and potential side effects. Education curriculum teach students to evaluate patients' responses to therapy and make appropriate decisions about continued treatment or modification of treatment plans. LPNs or LVNs. LPNs is for licensed practical nurse, and LVN is for licensed vocational nurse. The LVNs are primarily found in California and Texas. These nurses complement the healthcare team by providing basic and routine care consistent with their education under the direction of an RN, APRN, or MD or DO in a variety of different settings. The RN is a registered nurse. They perform physical exams and health histories. They provide health promotion, counseling, and education. They administer medications, wound care, and numerous other personalized interventions. They also interpret patient information and make critical decisions about needed actions. They may coordinate care in collaboration with a wide array of healthcare professionals, as well as direct and supervised care delivered by other healthcare personnel like LPNs and nurses' aides. And lastly, they conduct research in support of improved practice and patient outcomes. RNs may practice in all healthcare settings: hospitals, nursing homes, medical offices, ambulatory care centers, community health centers, schools, and retail clinics. They also provide healthcare in more surprising locations such as camps, homeless shelters, prisons, sporting events, and tourist destinations. The APRN, or the Advanced Practical Registered Nurse, is an umbrella term given to a registered nurse who has at least a master's education and clinical practice requirements beyond the basic nursing education and licensing requirement of all RNs, and who provides at least some level of direct care to patient populations. Under this umbrella fit the principal types of APRNs. Types like certified nurse midwives or CNMs. They provide well-woman gynecological and low-risk obstetrical care in hospitals, birth centers, and homes. And then clinical nurse specialists, or CNSs. They work in hospitals, clinics, nursing homes, private offices, and community-based settings. CNSs handle a wide range of physical and mental health problems. They also work on consultation, research, education, and administration. Certified Registered Nurse Anesthetists, or CRNAs, are the oldest of the advanced nursing specialties. The CRNAs administer more than 65% of anesthetics given to patients each year. So whatever path you choose, you are sure to enjoy a lifetime career of challenges and rewards if you select a career in the healthcare field. Sources for information in this presentation were obtained from the following: the September 20th, 2016 Allied Health Professionals Overview, Healthcare Careers from Monster.com. The December 17, 2015 Licensed Practical and Licensed Vocational Nurses from the Bureau of Labor Statistics, and the 2016 What Nurses Do from the American Nursing Association.